I welcome you all on behalf of Amogs and Indian Menopause Society. And I'm sure we are going to have a wonderful webinar on most interesting and intriguing sessions, which include genitourinary syndrome of menopause and graceful aging. Without much ado, I hand over the session to Madan Kamble sir. Over to you, sir.
Thank you, Dr. Anjali. This is our program. Among Sexual Medicine Committee is always doing one or two monthly webinars with different societies. This time I planned with Menopausal Society of Pune. It's my pleasure to have association with this society, and I thank Dr. Girija Wag madam, Dr. Arundhati ma'am for allowing me to associate with Menopausal Society of Pune. And also I thank Dr. Anju Soni ma'am for accepting the invitation as chief guest, and also Dr. Kiran Kurtkoti sir, our president Amogs, for accepting my invitation for this program. I invite all the dignitaries to join the lamp lighting. It's my pleasure to invite and introduce Dr. Anju Soni ma'am, who is the chief guest of today's session, who is currently president of Indian Menopause Society, and she's past vice president of FOXY, also past secretary general, governing council member of ICOG, and main thing is she is VP elect of FOXY, and congratulations for that, ma'am. I welcome you for this wonderful webinar, and we need your blessing, ma'am. Over to you.
Thank you, Dr. Madan. You have really organized a very, very beautiful webinar. And we all know that education is a very, very important part for all of us. And, organizing a webinars like this always brings in a lot of light for all of us through education. And today's topic, which you have chosen, are also very, very dear to my heart, because I think last 1 year, more than a year, I have been just talking of one of the very topics which I have been talking again and again is GUSM, that is genitourinary syndrome of menopause, because it is very, very crucial, and it is an eyes of bug. Most of the women who are suffering from this problem do not come forward, and they are suffering in silence, and less than 50% report the problem, and further only 6 to 7% of those who report take the treatment, because there is very little awareness regarding this problem, that women consider it either a part of aging, or they do not know that there are treatment options available with them. And most importantly, even the professionals who are treating the woman, they do not understand that these problems are there after menopause, and they gradually increase, and there are treatment options available, and if given, the woman feels really better. And with this problem, not only the urinary problems are there, like recurrent UTI, burning, it prolapse and all those things, but also there are lot of relationship problems, sexual health problems, and lot of women go into the depression. So we have to treat the woman before it is too late, and we have to be aware of the problem and come forward, ask leading question. And second topic, which is a panel which will be taken again by Dr. Milind Shah, and I can see all the experts from Dr. Anand to Dr. Shubha to Dr. Girja and Vaishali and Raki and Dr. Jayarani Kamraj. All of them are experts in the field, and I know a lot of them are going for their future endeavors, and I give my best wishes to all of them. And here I would like to just add that aging gracefully is another very important phenomenon nowadays. There are a lot of things associated with aging gracefully. We all know that there is a term which is known as compression of morbidity, and that is what we are looking into, not increasing the age, but living healthily with minimum of illness. So, and also that is very important. So I'm sure uh, with the moderation of panel by an expert, Dr. Milan, and all other panelists, there is going to be a very good, great discussion, and all who are attending this webinar will be definitely get benefited. So I thank Amogs Sexual Medicine Society who have invited me today to this beautiful program, and I'm sure everybody will have a great time. Thank you very much.
Yes. Thank you, Anju ma'am, for your kind blessings and kind words. You have very well highlighted the problems of menopause and the recent treatments and about the psychosexual health, its importance, and the solutions which are available for that. Thank you for being with us. I also welcome for today's session the eminent speakers. All the faculties are. I have selected all the seniors and experts from this field. uh, Dr. Uma Wankhede ma'am, who is the great speaker, and we have got chairpersons for this, Dr. Arundhati ma'am, Dr. Shubhada Jatra ma'am from Pune, and of course the great panel moderated by Milind Shah sir. We have got respected Dr. Anand Shinde sir, Jairani ma'am, Vaishali ma'am, Shobha Gudi ma'am, Rakhi Singh ma'am, and of course our own Girija ma'am. I welcome all the dignitaries for this wonderful session today. Dr. Kiran Kurtkoti sir could not join. He is occupied in a meeting. Then we will straightway go for the uh, scientific sessions. Thank you again, all the uh, dignitaries and Anju ma'am. Thank you. We'll start the first session. First session is topic is genitourinary syndrome of menopause. Uh, the speaker for this is Uma Wankhede ma'am. Chairpersons for this session, Dr. Arundhati Kanade ma'am and Shubhada Jatra madam. Dr. Arundhati Kanade madam is a consultant obstetric gynec at Dinanath Mangeshkar Hospital, Pune, and at private clinics, 3 clinic at Erandwane, Pune. She is so much interested in high risk obstetrics and endoscopic surgery. I welcome madam. I think Shubhada ma'am has not joined, I think. She is senior person, past president of Menopause Society of Pune. I welcome both. I request Dr. Uma ma'am to start your topic. We are eager to listen. Thank you once again.
Should I share my screen?
Yes, yes. I have stopped share.
Can you see?
Yes.
The
no, you have not shared yet.
1 second. Can that Shubhankar share? I've sent him my.
Yes, ma'am. Yes, ma'am. 1 minute. Is it visible, ma'am?
Is it visible, sir? Madan
Yes,
sir?
yes. It is visible.
Okay. Put it on slide share. Full screen. Yeah. So very good afternoon to all. Good afternoon, chairpersons and all who are present. The topic today of mine is genitourinary syndrome of menopause, which is one of the most common problems felt in menopause. And as you can see, menstruation, menopause, mental breakdown, all women's problems on a lighter note begin with men. Next. So genitourinary syndrome of menopause is a condition due to the atrophic symptoms and signs women may experience in the vulva, vagina, bladder, and urethra because of loss of steroids like estrogen and androgens that occurs with menopause. Next. Estrogen receptor, previously this condition was called as atrophic vaginitis or vulvovaginal atrophy, but now the name has been changed from 2015 to genitourinary syndrome of menopause. Uh, so this is because one, in vulvovaginal atrophy, there was no importance given to urinary symptoms. Second, women were not very happy to use the word vulva vagina when they describe their condition. And also, now the urinary symptoms are given precedence. So from 2015, the name of the atrophic vaginitis or vulvovaginal atrophy has changed to the genitourinary syndrome of menopause. We know that there are estrogen receptors all over the vagina, urethra, bladder, uterus, and pelvic floor. And estrogen deficiency is one of the most important problems of menopause. So it causes all these problems, most of these problems. Genitourinary syndrome of menopause affects a lot of women, about half of postmenopausal women. And to diagnose GSM, we do not have to have all symptoms. We can have either urinary or vaginal. We don't have to have the constellation of symptoms. And the worst thing about this condition is it is chronic. It's not going to get better. It only gets worse as the woman ages. So the woman need not expect that once she takes treatment, she'll never get the condition. It will be temporary and again it will recur as time passes. And it does not include the vasomotor symptoms like hot flushes, etc. It is mainly restricted to genital and urinary system. Next. So as I said again, the change in terminology was made in 2014 because previously there was no reference to lower urinary tract symptoms, and now we all know that lower urinary tract symptoms is one of the worst distressing complaints in menopausal women. Next. The reasons women still today do not speak with their doctors include very much embarrassment. Most believe that all these are normal part of aging and nothing can be done. And they don't feel like discussing all these topics with their doctors unless the doctor himself or herself gets into this and discusses with the patient. Next. So the most important is the ovary shrink. There is thinning of cortex and increase in stroma. This contributes to androgens, which may sometimes cause hirsutism. And the ovary does not produce the eggs, and estrogen is becoming lesser and lesser. And that's the most important cause of the genitourinary symptoms. So treatment will be directed to this problem mainly. Next. So now let's see the different physiological changes in menopause. We know that the uterus atrophies and the size of the uterus decreases. The body to cervix ratio becomes almost equal like a child. And so we are worried about perforation, etc. if hysteroscopy is done. And the endometrium thins. And generally the endometrium is less than 4 to 5 mm in a postmenopausal woman. Next. The cervix, there is inner migration of the spermocolumnar junction. There is decreased secretion of the endocervical glands. Sometimes the cervix stenosis leading to a pyometra, and many times the colposcopy is unsatisfactory because the spermocolumnar junction has gone inside the canal. Next. Most important is the vagina. So we know that the premenopausal vagina is having erectile tissue. There are rugae. It's nice and pink. And most important is it secretes a lot of glycogen. And there is a lot of lactobacilli, which converts glycogen to lactic acid. And this makes the vaginal pH acidic. And this prevents infections. While in a postmenopausal vagina, it's very pale. There are no rugae. And there's loss of glandular function and the vaginal pH becomes alkaline. Next. So the vagina atrophies, you can see that the epithelium, which is so much stratified squamous, becomes very thin, consisting only of basal epithelium. The vagina becomes very short. It's very narrow, contributing to dyspareunia of menopause. There is absent Doudin's bacilli. The pH, as I said, becomes alkaline. And most important, the maturation index becomes the superficial 10, intermediate 85, and basal 5. Previously, the premenopausal vaginal smear would have shown a lot of superficial cornified cells, But as the age occurs, the conified cells become less and the intermediate and basal cells increase. Next. What happens in the bladder? The bladder atrophies. There is a mucosal thinning of the bladder. Sometimes we know that there is histocele in the menopause. The capacity of the bladder to drain bladder, urine becomes less, so the post-void residual urine increases, leading to infections. And the bladder oversensitivity and decreased sensory threshold contributes to the overactive bladder seen in menopause. Next. There's a condition called interstitial cystitis, which is a very chronic, distressing urinary complaint. And many women first find out symptoms of interstitial cystitis after menopause because a decrease in estrogen in the bladder activates mast cells, and the bladder lining and reclusa are affected by inflammation, mast cell activity, and estrogen. And there's a low-grade inflammation over many years, and this combined with the hormonal imbalance causes the interstitial cystitis either to appear in menopause or to worsen if it has already occurred. Next. What happens in the urethra? The urethra becomes shorter so that there is no chance of infection entering the bladder. There is meatal stenosis causing strictures, which adds to the urinary complaints. There is a epithelial mucosal thinning of the urethra. The urethra becomes hypermobile, and there's a change in the vesico-urethral angle causing stress incontinence. And also because of age, there's a basic intrinsic sphincter deficiency causing stress incontinence, which is a very common problem of the menopause. Next. So literally the bladder rules the life of the postmenopausal woman, and they go from doctor to doctor without any relief of their symptoms. Next. We know that the fallopian tubes atrophy, cilia disappears, new muscle layer becomes thin, the vulva, the labia majora, minora become very flat. There is scanty pubic hair, and introitus narrows, contributing to dyspareunia. There are decreased Bartholin gland secretions, so there is dyspareunia because of loss of lubrication. In the pelvic floor, there's a loss of muscle tone, ligaments get weak, causing prolapse. There's scanty pelvic cellular tissue, and there's descent of bladder neck causing stress. Next. In the breast, the glandular tissue atrophies, fatty tissue increases, so mammographies are easier in the menopause. The breast becomes pendulous as the Cooper's ligament becomes less elastic. The alveoli disappear, ducts decrease in size, and many times fibrocystic changes occur in the perimenopausal breast, leading to breast pain and tenderness. Next. So what are the problems? The vaginal problems, very important, is the atrophic vaginitis, then the different vaginal prolapse as cystocele, rectocele, enterocele, and urethrocoele. And there's a lot of sexual problems in the menopause related to the vagina. Next. So atrophic vaginitis is a chronic progressive condition characterized, as I said, by pale, thin, shining, shrunken, and atrophic vagina. The atrophic changes also affect the urinary tract because of the common embryological origin. The condition develops slowly and takes 5 to 10 years after menopause to manifest, and it affects almost 50 to 60% of postmenopausal women. Next. Because of the raised pH, etc., in the vagina, there could be bacterial infections, there could be fungal infections, there could be cracks, fissures in the delicate vaginal wall. Even a common speculum examination may cause a crack, and this could cause bleeding and apprehension, and even bleeding after intercourse. Next. So there's a change in the quality and quantity of vaginal secretions. There's a shortening of the vagina. The vagina, when you have a look, it is very thin, loose. There are no rugae, and it looks very pale. The surface is friable. The clitoris atrophies, and the clitoris gets more easily irritated. Next. So the most common symptoms of vaginal dryness is itching, burning, increased frequency of urination, painful sex, occasionally postcoital bleeding, irritation, stinging, and many times women are treated all the time for fungal infections, etc., when actually the main problem is loss of estrogen. Next. So as you can see, the vaginal dryness goes on increasing. Pre-menopause, it is 3%. It goes up to 50%. 3 years after menopause. Next. So there is a calculation of the vaginal health index by which you could get an idea of the condition of the vagina, which includes the pH. The pH changes to alkaline, the moisture decreases, the rugosity decreases, the elasticity decreases, the length decreases, the thickness decreases, the epithelial integrity decreases, and the vascularity decreases. So the vaginal health decreases in menopause. Next. There's a lot of sexual dysfunction. I said before, one of the reasons is dyspareunia because of vaginal dryness and vaginal shortening. Then there is also a low sexual function related to desire, arousal, orgasm, lubrication, satisfaction. The woman is worried about change in body contour. She has put on weight, her breasts are sagging, so she's not very comfortable during sex. And also there are many mental changes at this time of life, like depression, anxiety, which adds to the low sexual desire. Next. So this, as Madam said, could cause a lot of relation problems. Now, next, what happens to the vulva? So the two most important problems could be lichen sclerosis and vulvodynia. Next. So lichen sclerosis is a condition of menopause where there is atrophy of the vulval epithelium. Vulva becomes very thin and friable, and on examination, the area looks very pale, and it causes a lot of burning, and patient has problem in walking, etc., because the area is almost irritated, chafed, and stingy, and the cause is because of the pale epithelium, the thin epithelium. Next. So you can see that the epithelium, which was thick stratified in the vulva, becomes very thin and cornified, and this is the condition of lichen sclerosis. Next. While vulvodynia is not so common, it's a chronic pain syndrome in the vulva and occurs without any cause. Symptoms occur like burning, irritation, and it is that for diagnosis of vulvodynia, the symptoms should be at least lasting for 3 months. Next. Now, atrophic endometritis also can occur. I said that the endometrium becomes very thin, less than 4 mm. So this may cause spotting or bleeding. And it's the commonest cause of postmenopausal bleeding. But of course, it's a diagnosis or exclusion. We must exclude other serious conditions before labeling it as atrophic endometritis. Next. So this is a very thin, pale endometrium. Next. And the HP of the endometrium shows the loss of glandular cells and atrophic endometrium. Next. There is a lot of pelvic floor dysfunction causing conditions like prolapse, stress incontinence, and also flatus and fecal incontinence. And this is very embarrassing for the woman, the stress incontinence and the flatus incontinence because of the weakening of the pelvic floor. Next. So we can have prolapse, histocele, rectocele, enterocele. One of the causes of all this is the menopausal estrogen deficiency. Next. Now in the urinary system, there are a lot of problems like atrophic cystitis, atrophic urethritis, urethral caruncle, urethral prolapse, and urethral syndrome. Next. So this is urethral caruncle, a very red velvety area at the urethra. It has to be seen on local examination. Patient has a lot of urinary problems like burning, frequency, and we cannot just treat it as UTI unless you have a look and see if it is there, because these condition needs surgical management. Next. Another is urethral prolapse, which is a prolapse of the urethral opening. This also has to be had a look so that you can diagnose this condition. This also causes a lot of frequency burning during micturition, and the treatment is mainly surgical. Next. And urethrocoele, we know, is the prolapse of the lower anterior vaginal wall with the urethra. So this also causes incomplete evacuation and frequency of urination. Next. Urethral syndrome is recurrent urethritis. Patient has burning micturition, frequency, urgency, nocturia, post-void dribbling, and she keeps doing cultures, and every time the cultures are negative, and we keep giving different antibiotics, nothing is working. What the patient needs is estrogen. Next. So the causes of recurrent urinary tract infection, I said, is atrophic urethritis. Urethra cannot prevent infection from ascending. There is stricture urethra, so the bladder cannot be emptied properly. There is atrophic vaginitis, so the bacteria in the vagina are different, which can colonize the bladder also. There is decreased detrusor contractility, so the urine is not emptied. There is decrease in bladder maximum capacity, and most important, there is asymptomatic bacteriuria. 9% in women over 65 to almost 50% as women goes above 8 years because of the change in pH of the bladder. Next. Now the urinary incontinence of three types. The commonest is stress. Patient can have urge where she has an intense impulse to pass urine before reaching the washroom. And there is a lot of detrusor overactivity called the overactive bladder, where there is urinary urgency with or without incontinence, frequency, nocturia in absence of infection. So all this should be ruled out when woman comes to us with urinary complaints. Next. So now for treatment, for approval of drugs intended to treat genital syndrome or vulvovaginal atrophy, the FDA requires that the patient has to have at least one moderate to severe symptom, have less than 5% superficial cells on a vaginal smear, and the vaginal pH has become more than 5. But usually we treat patients based on their symptoms. Next. So now the treatment, the most common we give is lubricants. Lubricants can be used alone or with estrogen creams. Lubricants are fast acting, they provide temporary relief, and are especially useful for women who have dryness and symptoms during intercourse, like dyspareunia. Lubricants differ from moisturizers in that they are not absorbed into the skin, they just act locally. Next. Moisture is also an excellent option for women who experience discomfort due to vaginal dryness. Moisturizers are hydrophobic and have bioadhesive properties. They absorb into the skin and the vaginal mucosa. They have the ability to retain moisture, which is then released locally like physiological vaginal secretions. Next. Hyaluronic acid is a very promising drug for the vaginal dryness. It's a naturally occurring polysaccharide and is one of the main components of the extracellular matrix present in epithelium of the vagina. It has strong antioxidant properties that connect water and is considered a naturally occurring reservoir of body water that can increase moisture levels and improve the dryness and atrophic symptoms. So all these are mainly used for the sexual problems and the vaginal dryness. Next. Laser is the upcoming treatment, and you can see in all the workshops that they say that it restores the vaginal epithelium to a state similar to that of a premenopausal woman. But several international bodies have released consensus with the majority reporting that the routine use should not be recommended and further research is needed. Next. Now, most important treatment is, of course, local estrogens like estriol, Premarin, or vaginal pessaries. Which, if you are using a cream, it should be applied daily for 3 weeks and then 3 times a week till the symptoms go off. The rationale behind this administration is that the absorption of estrogen is highest during the first few days when the vaginal epithelium is very atrophic and has a thin epithelium. Once the epithelium has matured, say after some 2-3 weeks, the absorption of local estrogen decreases, and therefore smaller doses of estrogen are sufficient while ensuring the systemic absorption is minimal. So this is one of the good treatments because the absorption is less and it hits the nail on the head. There is estrogen deficiency, and applying the creams will help the epithelium to improve. Next. Systemic estrogen is given when patient has vasomotor symptoms and genitourinary symptoms. But after the vasomotor symptoms go off, systemic hormones may not be so good as local estrogens. You can use estrogen alone for hysterectomized women, but if there's a uterus, you should give estrogen and progesterone. Next. This is a very upcoming treatment, dehydroepiandrosterone, available as a pessary. At menopause, the secretion of estradiol by the ovary stops, and DHEA becomes the exclusive precursor for all sex steroids. Androgen receptors are present all over the genital tract. So together with that estrogens, the level of androgens falls, contributing to the symptoms like loss of libido, etc. So this is used as a vaginal insert at bedtime, and it's supposed to have a very good effect in one of the upcoming treatments of the GSM. Next. SERMs are also upcoming. They are selective estrogen receptor modulators. They are non-steroidal drugs that have agonist and antagonist activities. So they have a agonist activity on the vagina, while antagonist on the breast, while osmethane is the only SERM currently approved for the treatment of moderate to severe dyspareunia and vaginal dryness. Next. About the management, patient preference is paramount, as adherence and compliance are crucial, because even if you use local estrogen, patient may feel good, but symptoms recur and they'll have to repeat the treatment as they age. So compliance is very important in obtaining a significant improvement in the symptoms and quality of life. The principal goal when treating GSM is to relieve symptoms, but cost, treatment safety need to be considered for each individual. Before I end, I would like to say that sometimes CA breast patients, they are on tamoxifen. They have a lot of problem. For them, we are really in a quandary how to give local estrogens, because we know that estrogens are not safe in CA breast patients. So initially we would give them the other treatments like lubricants, moisturizers, etc. But if the many times because of tamoxifen, they have a lot of issues and they have a lot of symptoms. So maybe we'll have to start the local estrogens in consultation with the oncologist. Next. So all in all, there are a lot of issues in menopause, but the good thing is it's multitasking. Patient can laugh, cough, sneeze, and pee all at the same time. Thank you very much.
Thank you, Uma ma'am. It was a great talk. I request chairpersons to give their comments.
It was an excellent talk, Uma madam, like always, and in which you covered everything, and also the management, in which genitourinary syndrome of uh, is the most difficult problem nowadays, because almost every other patient comes with it. So thank you for a very broad coverage of the talk.
Thank you.
Shubhda ma'am.
Yeah, as usual, Uma, you were really excellent. Covered each and every topic and went into the depth of all the changes that occurred, and you covered the treatment part also. Thank you for covering it in so much detail. Thank you. And thank you, Dr. Madan and the team for giving us this opportunity. Thank you
Yes.
so much.
Thank you, chairpersons, for
Yes,
coming,
thank you.
accepting, and coming.
Thank you, Dr. Madan. Thank you.
Yes, thank you, ma'am. Yes, just Milin Shah sir has arrived. She was busy. Welcome, Milin sir. Uma madam, thank you. It was really wonderful presentation.
Thank you very much.
Now I welcome all the faculties for this symposium, graceful aging, which is a different topic, needs to be discussed. Interesting topic. For this, we have got moderator Dr. Milin Shah sir. I welcome Milin Shah sir, and the chair participants for this, Dr. Anand Shinde sir, Dr. Shobha Gudi ma'am, Dr. Girija Wag ma'am, Dr. Rakhi Singh ma'am, Dr. Vaishali Chauhan madam, and Dr. Jayarani Kamraj ma'am.
Thank you very much, Madan. Yes, in
Yes.
fact, I could manage to join. I was a bit held up in a case, but your wish and your hard work, But I really
Just-
missed Uma. I wanted
Yeah.
to speak with her, anyways. Yeah, you
Yeah.
continue. Please continue.
Yeah. Milin Shah sir is the past president of ISOPAB, past president of IMS Solapur, past president of Solapur OBGY, and he is a senior OBGYN and a sincere Foxian. I welcome sir. Dr. Anand Shinde sir is a senior IVF consultant at Dinanath Mangeshkar Hospital, Pune, director Andrology at IVF Pune, past president of POGS, senior PG teacher, practicing more than 35 years. I welcome sir. Dr. Shobha Gudi madam. She is a postgraduate teacher, professor and head at Bangalore, past president of Bangalore OBGYN Society. And I welcome ma'am for this session. Dr. Girija Wag madam. She is a past vice president Foxy and professor at Department of OBGYN, Bharati Vidyapeeth Medical College, Pune, a senior consultant at Cloud9 and Apollo Hospitals, Pune. Dr. Rakhi Singh ma'am, she is the president of Noida Society, governing council member of ICOG, vice chairperson of UP State ISAR, also past chairperson of Endocrinology Committee. Welcome ma'am. Dr. Vaishali Chauhan madam, she is director at Cloud9 Hospital, Kalyani Nagar, Pune, working at her own Sanvi clinic, also PG teacher, past chairperson of Perinatology Committee of Foxy, and past general secretary of Pune OBGYN Society. I welcome madam. Dr. K.S. Jayarani Kamraj ma'am, senior consultant of reproductive medicine at Akash Fertility Center, Chennai. She is joint secretary TNFOG, also past president of OXY, vice president of TAPISA, also South Zone coordinator OXY No to Violence Committee. She has so many awards in her name. I welcome Jayarani ma'am. I welcome all the participants for coming and joining and accepting my invitation. Now I hand over to Dr. Milind Shah sir to continue with this wonderful discussion. Over to you, sir.
Yeah. Thank you very much, Madan. In fact, I was just head up in the OT, but issued my surgery and I could join. That's really nice that I could join exactly at the time when the
I think Girija ma'am has not joined.
Yeah.
Vaishali ma'am?
Yeah, Dr. Milind is
Ah.
at us. Something has happened.
It's,
Yeah, I think he has lost his connection. Probably he will join back
no,
again.
he's there. Milind Shah sir is
Is
there.
there?
But the video is off.
He
Video
lost
is off.
connection. He was speaking right now.
दिसतंय समोर.
But
नाव तर दिसतंय.
no, he's left now.
Okay. Mm-hmm.
I think he has connection problem.
So,
Okay.
Dr. Madan, very brave effort by you to conduct a webinar on this complex subject. Actually, I have always found that this is a very challenging area of gynec practice. And I always admire those who are proficient in it and, are doing so well. So it is good to see Jairani here. Hi, Jairani.
Hi, Shobha ma'am.
Yes,
Hi.
thank you.
Thank you,
And
Madan. Hi,
very
Vaishali.
nice.
Yes, thank you.
Vaishali,
Hello,
Rakhi.
ma'am.
Hi, Vaishali. Hey,
So
Rakhi.
Nice to get connected.
Yeah.
And
Best
that was
wishes for Jairani ma'am and Vaishali ma'am.
yeah.
Thank
Best
you,
wishes.
thank you,
Excellent.
thank
I'm
you
also
so
there
much.
in line,
Rakhi,
Madan.
Rakhi
yes,
is also
Rakhi ma'am.
there.
Yeah.
Don't forget me.
No. How can
Nobody
I forget
will
you?
dare to forget you, Rakhi.
It is not that way, darling. It's with
Everyone
folded
is
hands.
working
नहीं
hard.
नहीं ऐसा नहीं मजाक भी होता है and that was a good talk, a very comprehensive talk by Dr. Uma, and I think that the particular aspect she spoke on is actually, we see it every day but we fail to address it in our patients, and an early initiation is very necessary, and also a leading question is necessary when we are taking history of perimenopausal and menopausal women. They may come with any other problem, but we must try to take history and start the treatment early so that the atrophy is some amount can be, it does not become severe. It is not possible to completely avoid genitourinary atrophy, but it can definitely be slowed down and it can be lessened quantum
Yeah.
if we give it early and if we give it at good for a good number of years. Yeah.
Yes, right, ma'am.
Good,
Shasan.
yeah.
Hi,
Is it
Milind.
audible now?
Welcome back.
Come. Yes,
Hi,
welcome back,
Shobha.
sir.
Hi.
Yes.
Hear you.
Yeah, is it audible?
Yes,
It is very
Yes, sir.
much.
Yes.
Sir,
Your
you
Okay.
got
bandwidth
this.
is
I'm
low.
Sir, you got this cap in Siliguri, sir.
Oh, yeah, this it was given by Atisha and Bella.
Oh,
They always give me the wonderful caps, and that's the patient said,
very, very
we are
special
going to
for you.
operate at your place because of your cap. I said, good. Good, yeah.
Oh, good. It's your
I
signature
was
style
speaking
now.
just now, and then suddenly I saw still. So I said something went wrong, and I said I will just once again connect. Yes, yes. Should I start now then, Madan?
Yes, yes, sir. Please, please.
Okay. So I was speaking and suddenly it got still. So I thought there must be something wrong as well. So again, I rejoined this particular meeting. At the onset, I must say big thanks, Madan, to you and the entire group of your committee as well for this wonderful opportunity. In fact, Kiran and Bipin have revolutionized the Amogs, what I could see in the last 1 year. And that too, when you gave me the list of the panelists, it was mesmerizing because all were so good friends, and rather all are the examples of aging gracefully. Look at Shobha, Jayarani, Rakhi, and Vaishali. Will you call that they are having any age process in them? No.
No.
And more so, and more
You
so,
also,
Anand,
you
a
also,
very
sir.
good friend of mine. Yes, he's the
I
only one
don't
who.
know, Milind, I don't know what to say. Only thing is, I feel highly complimented by being put in the same group as Vaishali.
Madam,
Okay. Yeah,
same
yeah.
goes for you to be counted with you. A privilege
Great,
really.
great. Good. And Anand has joined, na? Anand has joined?
Yeah, sir
Yes,
is there, I
yes,
think.
he's there.
He's there, na? Yeah, good. So Anand is another example. I remember he has stopped actually putting the dye in his color hair, but still he always very enthusiastic in all the activities. And whenever we meet, we always have a wonderful academic discussion with on various topics in OBGYN. And that's how I thought when this particular panel was given to me, aging gracefully. I remember few years before we had a similar panel done by me and Madan, and it was really so well taken. We started getting so many actually calls from the corners of the country about all those the newer things which have come up, especially the energy based devices which we can utilize especially for this aging process as well. So let me share my presentation now. Yeah. um, Shubhankar, you have done me as a I can share my presentation.
Yes, sir. I will make you a co-host.
Yeah, please make me co-host so that I will be able to do that. Yeah. So I think it is here. Yes.
Sir, you can share now.
I can share now. Okay, 1 second. Let me just check. Yeah. Yeah. Can you see my screen? But probably not in the screen actually mode it appears. Yeah. Yes. Now how it is looking at your end? It is seen as a complete
Yeah.
screen.
Yes, sir. Yes.
You are able to see that?
Yes,
Yes,
it's
sir.
full screen.
I will just quickly see whether it is moving also. So
Yes,
it's
sir. It's
moving.
moving, sir. Yes, sir. Moving,
That's
sir.
wonderful. See, that's what. Yeah, yes, Rani. Because sometimes we have so many things on our mind, and the technical hinge always objects, and it always gives you little trouble. Same thing, I think, with the age as well. We want to do n number of things, and when I see the aspirations you all have, you always and always want to do more things, and the age comes in between. But yes, the age is just number. We can definitely bring a lot of changes. Suppose we adhere to this particular title of aging gracefully. And that's why whenever I say so, I always and always remember none other than my favorite actress and not only actress, the sister of my another very good OBGYN friend who travels all the way, though she's more than 70. Probably you must have understood, Jayarani,
Yeah,
from the voice.
Kamala madam, Kamala madam.
Kamala madam, Kamala always comes to my events, and same with the Priya also. Now she comes, and she never says no. And she had come, in fact, to our event in Pune also. Probably Girija, you must be remembering, she had given the talk, and she traveled only for the talk from Chennai to Pune. So the Rekha is the ideal example now, who tells us that yes, age is definitely important. We need to understand the aging, but the age at the same time we should always and always see that how actually we can utilize our expertise over years because of this age. It is not only wrinkles, it is not actually your white hair, it is not only actually all those fat deposition which happens at places where we don't want, but what is more important is the enthusiasm that should pop up in your wrinkles as well, because that is the main soul actually which supports us while doing all those things. And that's why recently last weekend I was traveling to Vijayawada, Guntur, and then came to Chandrapur. I was just saying probably family was objecting for this, enormous travel, but Sadhna and me were discussing as we were there, because ऑलवेज फील उम्र कुड बी 55 की, बट हमारा सब लोगों का दिल है 55 का. And that's why we need to definitely address these elderly people who are over 60 years, and those are the people actually where they need much address as far as their utilization of their wisdom is concerned, their expertise is concerned. At the same time, they should do wonderfully good in their aesthetic look also. Friends, I'm very happy to say that recently, when my wife, actually at the age of 55, participated in the Mrs. India contest, and she won the title Mrs. India Digital Queen. But more so, I was impressed by a participant of 65 years, and she was asked to do the push-ups on the stage in Hotel Hyatt, and I was surprised she could do 20 push-ups in front of entire that audience with lot of grace. And that told us that yes, getting older definitely is one of the fact which is going to happen in us, but we should always try to put maximum whatever we can do in that. So let me start with the first question. Now this is a very open discussion, there won't be directed questions or nothing like that. So I am requesting you all to pick up the questions according to your interest, according to your expertise, and try to give maximum to our audience who had come here to understand what you do in your own clinic. And that's why let us start with the very basic thing. What is your perspective about the aging? What are its types?
So
Yes,
aging is something that it's a gradual process where your physiology, your psychology, and all your biological changes which happens in your body, sir. That is the main thing that we see as a changes which happens due to the biological functions getting a change to adapt to all your changes in the process of each organs goes through a lot of physiological as well as the biological changes, sir.
Yes, very true. And about the types of aging, anyone wants to comment, or yes? Anyone else?
Sir, basically,
Yes, yes, Raki, yes.
yeah, go on, Shobha.
Yeah, I just wanted to say that
Yes,
amongst
yes,
the
Shobha, yes.
entire, amongst all the types of aging you have shown, probably it is, the hallmark is the cellular aging, and we must understand that cell function will slow down after a certain age. And the underlying cause can be all the others one will contribute to this cell function slowing down. And but a lifestyle change, a new person evolving from the aging will kind of combat all these changes. So we need to give a message that you cannot reverse aging, but you can slow it down, and to do that we have to become a new person. We cannot be the same person who was there earlier. The lifestyle change should be so radical that you should become a new person. Yeah.
Yes, very true.
We have
It's
to
like being reborn.
we have to be basically adapting to the newer modalities and keep your heart young. Don't get that aging into your brain. Once it enters your brain, and once you
describe yourself as an elderly or you describe yourself as a very senior person, then that means it is stepping into it.
Yes.
See to it that you
I
have that thing in your
also-
mind that you are not elder. See to it that you are not aged, and you have to feel that you are very young at heart. If you are young at heart, at 90 also you are young.
Very
I
true.
also agree with Rakhi. So aging is inevitable. It is gradual deterioration of a physiological reproductive function. So our cells are going to age. But what we have, the cognitive function and the emotional well-being is important. Now we have patients who are our age, who are already grandmothers, and you know the way they come and their appearance, and we as busy gynecologists, we are so busy, like we don't have time to think that we are aging. So there's a complete, you know, at same age, two different women can look differently or behave differently or carry on with life differently. So is the perspective of how you look at the age.
So
Yes.
acceptance is secondly, you have to acceptance that though there is a biological aging, we still want to have certain acceptance in ourselves that we become little more matured or intellectual
But
in
I
a
would
different
like
way.
Jairani to tell tell one thing. Tell the whole body acts as a system. Tell the whole body of yours, every cell of yours that we are not aged, we are young,
Correct.
we can do it. Then definitely you can do everything. That is
Absolutely,
my
Yes.
I
mantra.
agree. I
Or,
agree with you
or
100%.
maybe on the
Yeah.
You
other
have to teach them that you can do it. I can do it and I will do it, and that's it. It echoes.
Yeah, yeah.
Every cell would echo it, and you will be doing it.
Yeah,
Yes.
that's very motivational. But maybe on the other hand, also accept that you're aging gracefully, and that
Yeah.
acceptance and entering into your age, maybe that could also be one
That
more.
is also another part of it. It should not be that superficial physically you're trying to do everything plastics, and then when you stand up you're not doing the exercise, you're not doing all that.
Yes,
When you stand up
exactly.
and everything
Very
is shaking.
Yes,
important.
yes,
Very
I
important.
agree.
Yes.
I agree with Rakhi that, you know, the physical fitness part of it and the
Yes.
emotional stability part of it, this is very, very critical and crucial. You know, it is secondary to actually, it is a primary, rather, the appearance becomes secondary. This is what is primary because that
Yes.
kind of
Yes.
health will automatically reflect in the appearance. And,
Yeah,
you know,
exactly.
yeah, see, Milind, it is not just the skin and the hair, it is a way a person carries herself and also
Yes.
the way that she kind of dresses with dignity in such a, you know, more in a way that befits the
Yes.
age. And also when we do the right thing, it becomes very obvious that, you know, we are aging with grace and we are accepting, but at the same time we are remaining young at heart. So appearances do
Yes.
matter,
Very true.
but
Yeah, yeah.
not just the
Yes.
cosmetic part of it. It is the entire way that the body language and the fitness part of it, the way we stand, the way we sit, the way we talk, everything is
Correct.
important.
Correct. Yeah.
Yeah,
So
correct.
this, yes. Yeah. It is very important. See, there are many Maharashtrian being Amoxians. You know, there's very famous Lavani, पिकल्या पानाचा देठ की ग हिरवा. That means though that particular leaf of the tree looks old, it's actually the base is definitely green always, and that's what it is. Now, all these beautiful women told wonderful about the aging, but Anand, I want to listen from you. What is your perspective about the aging and these types of aging? Yes, Anand? You are there, Anand? Hello? Hello? Am I audible?
Yeah, you are audible.
Yeah,
I'm
you're
audible.
audible, sir.
Anand, you are there, Anand? Madan,
Possibly, yeah.
please check is there.
I'll just call him and check if he's there.
Yeah, please check so that you know he can contribute, and then immediately we'll go to the next slide. Yeah. But by the time he joins, especially for all non-Marathi speaking, you know, this was a very famous song. We call it the Lavani. Lavani is known to everyone. That's why I'm saying rather than song Lavani. That means quite often we get these changes, but the mind, it depicts that it is not actually the base of that leaf, but basically our mind should be, our heart should be as green as it was before till the end of our life, and we can do wonderful things in our life. Suppose we keep that, and that emotional stability also comes with the same, in spite of all those changes which we see in the hormones, in the cells, and all those things. With that, suppose we feel that yes, there are certain factors. For example, recently I met Sachin, and Sachin says, suddenly I stopped remembering the names. And I said, yes, this is cellular aging. After 60, it happens, but you'll have to take the, very in good faith, and we'll have to see what actually you can do to cope up with this particular change as well. This Vaishali is there, or
Sir is gone for one meeting for his PG students, but he'll come back.
okay, fine. So once he comes back, please let me know, and then we'll ask him to give his perspective also. Now, where exactly the aging starts, mind or the body? I mean to say all those things which just now we spoke about. What is your perspective? Yes,
Body, sir.
anyone? Yes,
Body, sir. It is not the
body.
mind that
Yes,
goes. Yeah, because we always think that we are
yes.
young. We always think as a schoolgirls always. When you see our classmates and batchmates, we say the girls. My daughter used to say, Amma, you don't make so fuss. I'm telling my girls. She said, what is girls? So it means that we
Yes,
always feel in the mind young only. So it is a body that
yes,
changes because of all the physiology, biology, and all your cellular changes.
Yes,
yes,
Milind, I agree with Jairani. The
yes.
flesh becomes weak, but the mind remains strong.
True,
The
true,
flesh
true.
weakens earlier. But having
Yes,
said that, it is important not to weaken with the flesh, and then to see that how best we cope with that, how best we
Correct.
cope with the physical changes. And we kind of do not allow, because some things cannot be prevented. Some things, if you're genetically predisposed to, you can only do so much to prevent that. So you have to cope with. So coping mechanisms have to really accelerate as we age. Coping with the situation at house, coping with the children who are settling down, coping with those emotional conflicts, coping with the menopausal transition symptoms. And so all this, actually coping with the partner who is kind of retired and is having different problems now. While going to work, he had different problems. Now there are different problems, like that. So there are a
yes.
lot, and then we are also into Foxy. So
That
that
makes you
is
young,
also
madam. Shobha,
that
madam,
makes
that
us
makes you
young.
young.
Foxy
Yeah.
makes
But
us young, don't worry.
yes,
Yeah.
Foxy
yes,
makes
it
us
makes
look
us
young
young.
and
It's
we are
definitely an
more
asset.
attached.
We are very
It's
active. We
definitely
are
an asset.
actively traveling,
Yeah.
talking, thinking,
Yes.
planning, reading,
Yes.
We
many
are
things.
more
Yeah. But
rejuvenated.
please
People
remember.
ask why, but we are more
Stress buster.
rejuvenated with that.
Yes, but
Yes,
please remember your coping mechanism. Because of Foxy, you have to find more time for yourself because you're traveling
yes.
so much.
Yes.
So much.
Yeah, yeah,
So
That is
how will
definitely.
why,
you not
yeah,
allow your exercise routine should not be interrupted, your diet should be maintained? So these are the challenges. So we
correct.
need to kind of, so, and every professional or every woman, even a woman in a village who is aging, will have her own set of challenges as she ages. So that is the problem. So the one thing about the body mechanism, Milind, I just wanted to say that education may have some role in it, because
Correct.
this is the time when education stands in good stead for women. So when we talk to our young girls today, we should tell them, if your education level is good, it's not only for your reproductive health but also for your aging or menopausal health. So women who are well educated are able to preserve themselves better, are able to have better coping mechanisms, and they do well. So often nowadays, earlier there was a time, some 1 decade back, when most women coming into my to consult me appear to be older than me. Now I am older than many of them, but then I feel that some of them look older because of the hard life that they have led, or because of their poor coping mechanisms. So I just wanted to say that physical appearance can depend on that also, and on coping mechanism, and aging also, will depend on that. How
Yeah,
well a woman
Yes.
is able
definitely.
to,
Yeah,
yeah.
Shobha, as you
Yeah.
said, it also depends upon the amount of the hard life you've led,
Yes,
the
correct,
amount of
correct.
stress you've taken. It
Yeah.
directly reflects on your cells and your body image. Because the more the stress you take, the harder the life you take, it would be difficult. Once you have to be relaxed, you have to accept the things, you have to be peaceful at the mind, then definitely the cells are also happy if you are happy. That also reflects that way.
Genetics also plays a huge role in aging, you know.
Yeah.
Yes,
And
yes.
the environment around, the pollution and what we're eating, the pollutants, all this also play, and our coping mechanism, like you mentioned. But
Very
yes,
true.
genetics has a role.
Yeah, very important. Yeah, actually, I wanted to add upon, but Vaishali, you have done that. The aging always depends on the genetic makeup as well, and there's a lot of research going on. Any particular gene are involved in that, and they are trying to find out the type of genes, and that's why this process always and always continues. And that's why we need to know about it very, very carefully. But what are the basic causes of aging? Can anyone elaborate on that? Yeah.
A very beautiful slide you have already put up,
Yes.
Dr. Millie.
Yes.
Collagen breaks. As we age, the collagen goes down. That's where all these cosmetologists come in. You know, they pump in all that collagen in people's faces. So basically, it is a collagen breakdown. Then photo defense, oxidation, inflammation, and glycation. Glycation is actually like frying. Like when you're frying something, it becomes so. The more sugar you take, the more is the glycation, and more is the aging. So
Yeah, very true, very
like
true.
this.
Yes, yes. In fact, that is the reason. Recently, one of the patient came last week to our clinic. She wanted to have a little makeup of clitoris. She was 60 years old. And my staff was asking, at the age of 60, she wants to have this clitoris foot properly done. But yes, there are certain changes in the body which makes it little less sensitive as well as the shape changes. But we must appreciate her intention behind that, because every family differs, every actually couple differs, every person differs as far as their scenarios are concerned. We cannot be judgmental, we cannot be ourselves actually deciding, and we'll have to have our non-judgmental
ও এত
approach,
ফোন আসছে এটার মধ্যে
normalist approach. Hello?
বিরক্ত লাগছিল
Yes?
তার মধ্যে
Yeah,
আবার ওই
anyone is speaking?
ব্যথাগুলো শুরু হয়ে গেল
There's somebody by DJ M Doc.
Okay. DJM Doc. Yeah.
He's muted.
Yeah, Shubhankar, just mute him. Yeah, that's good. And Anand has not joined as it now, na? Anand has
Sir's
not.
name I can see, so maybe sir has joined, but sir is not speaking anything.
Ma'am,
Sir has joined?
I am
Anand?
Anand
Yes,
sir
yes.
student.
Anand, we want
Actually,
to listen to you because we all are speaking. We want to listen to you as well. And we learned that you went out. Yes.
sir, I am Anand sir's student. Sir, actually, sir is in a thesis meeting. He'll be joining soon.
Okay. So as soon as he joins, please let us know. We'll be happy to
Sure.
receive him. Huh? Yes. Now, actually, yes, yeah. The next very important thing which we need to discuss is all this aging actually, which causes the change in the aesthetics, the changes because of menopause, the geriatric problems, psychological changes, sexuality, which is again very important. All that we need to understand very, very carefully, and that's why it is very aptly said. The ways I see it, every year can be a brand new journey. Why wouldn't you want to experience all the wonder in each step on your path? That's why recently, when I had celebrated my 61st birthday, my daughters wanted to post it on the social media, and I used to say, "Don't post. I don't want to disclose myself as 61 because that unnecessary people start saying, 'Oh, abhi ye buddha ho gaya.' So that gives a feeling, sometimes. But coming to this important aspect of menopause, the GSM must have been discussed by Uma in detail, which I really missed actually in the earlier talk. But any particular your experiences which will be useful for the audience as far as the menopause, sexuality, about about the graceful aging. Yes. Have you faced any particular case which comes to your mind, which open your eyes, or quite the eye opening sort of thing for our practice when it comes to this menopause or the sexuality or the aging process?
So I used to come across a lot of patients at 70,
Yes.
sir. 70,
Yes.
they will be coming. This women will be around 65, and the man, once he even retires, and after some time he becomes very bored. For him, only sexual act is a very important aspect of hobby. So they both are
Yes.
alone. So many a times I had some 6 or 7 patients with 70 years to come with a wife complaining that they have more of a sexual desire. And that is the
Yes.
one important thing that they want to talk, and they want to really not to complain, but they want to ask how I can make it well comfortable. That is a very interesting thing. They don't complain, they want to make it as a very happy one. So that is one aspect that we should see as a aging women wants to be more happy with the husband, both in everything. Rather, it is not only the intimacy or the relationship, but also the sexuality also play a role. All in their life together, this is the time that they spend, they see more happiness in their relationship.
Yes. 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 Anyone
Ended like
others
that.
who want to tell something opposite as well? Someone face problems for the sex
Yeah,
because of
there
sex?
is a lot of senile vaginitis, and this people
Yes. Yes. Yeah.
come with these symptoms, complaints, and whatever you treat, they keep coming back, recurring symptoms which really do not respond. And at this age, you cannot even give them oral estrogen. You can give them local, that also not every day for a short period of time. So it's very difficult to treat the atrophic vaginitis with recurrent dryness and
Yes.
postcoital pain. Sometimes there are patients come with tears also.
Yes.
Yes.
Yeah.
Yes.
Atrophic changes.
Yes.
There are a
Very
lot of
true.
atrophic changes, and I would like to highlight one thing. There was a patient who had a lot of senile vaginitis and all the discharges and all that, but she was not happy doing all that. And
Yeah. Yeah.
she had gone to a local doctor. What was given to her was xylocaine gel, and that worsened the whole scenario for them. I would like to tell all my patients, please do not prescribe xylocaine gel, and if you're
Yes.
prescribing, tell the husband to use a condom if it is. That is
True,
one thing
because
which I
it
would like to
causes more
highlight.
actually abrasions and tears too.
Yeah, they would cause a lot more harm than doing good to it.
Doing good. You know, friends, that's the thing. Recently, I met a very sort of interesting case where, as you said very correctly, they got actually the little problems with this particular sexual practice after aging, and she was class one officer and always used to get the ulcers in the forehead, and that's why she was so worried. Had been to many places, was received so many lubricants and all other things. You know what a different thing which I did, which gave me a rewarding experience was I saw those recurring ulcers on the forehead and we gave PRP. We gave PRP and suddenly everything got healed. But the lady was very intelligent. She said, Doctor, I'm so happy that first time I'm seeing a normal actual mucosa there. But now I'm worried about the recurrence because suppose my husband performs, I will get the same. And we said, yes, we know about it. And we already had given her actually advice for the 3 sittings of the laser because we wanted to make that mucosa a little more stronger as well with the laser therapy, and this energy based devices make a difference, and now she's so happy. Brother couple is so happy that they're able to perform without those ulcerations and all those things. Now how does aging affect the sexuality in the teenage group and how to manage it? Yeah, anything a little out of box question for you? Yeah.
Yeah, I think uh, early debut today, the early
Yes.
debut of sexuality amongst teenagers, I think it leads to slight desensitization after some time,
Mm-hmm.
particularly because of the disillusionment they will have over failed relationships, etc. So that is what might lead to it. But there is, I feel that it could be a fluctuating pattern for them, and they do recover very quickly after some time. Uh, Premature menopause, that is or premature ovarian insufficiency, the silent patterns which we see, especially women come with infertility. I think that is the cohort where the couple may experience, in addition to that complex problem of infertility and social stigma, the poor couple may also have, decreased urge and decreased sexual experiences. It's very unfortunate in that cohort.
Yeah.
And that is the reproductive age group problem that you are saying it managing. If we are able to identify premature ovarian insufficiency, which is quite so in addition to treating the infertility aspect, we must focus on making them comfortable with the sexual aspect also. And unless that happens, of course, the chances of conception also will not increase. In the teenagers, a lot of counseling, and one research has shown that adolescent and teen and youth sexual behaviors always improve when there are periods of abstinence in between. Okay, so when they are very frequently changing partners, or they are having steady relationship, maybe, but they indulge more often, maybe they will find weakening of the desire. So if there are spells of abstinence, actually the things recover.
Very true,
Things
yeah.
recover. Yeah.
In fact, my
So
next question was the same, Shobha, because see, recently another lady came to my clinic, and what was her complaint, and the little, the worried about was husband was insisting for the daily intercourse, and she was absolutely got worried because of that, because she says not a single day he is refusing, or on the contrary, is insisting that every day there should be intercourse in the couple, which was bothering her a lot. And she said, no, can you do some counseling to my husband to decrease his libido? And that was the another actually big question mark in front of me, what actually and how exactly I should deal with the case. Let me put that patient in front of you all, and what you will do suppose such particular complaints comes in your clinic, or the patient comes with that complaint in front of you. Yes.
So daily sexual intercourse is not an offense or not a bad one. So we have to tell them it is not abnormal to have a daily sexual intercourse. So ideally speaking, that we have to look into their psychological aspects of what is the background that they have.
Yes.
That is very
Yes.
important, because it is not the physiological problem, mostly the psychological aspects of her surrounding situations, home life, marital conflicts, and the family disputes, economical constraints. All those things matter a lot regarding this, because many times most of the study says it is mostly the social and the psychological factors play a very important role in this type of a complaints like daily sexual act and all those things. That is one important aspect we have to keep in mind. We have to ask in detail
Yes.
the history. We have to ask mostly for the relationship issues and their social problems. That is a very important one. We have to look into it.
Yes,
Yeah,
very
very
true.
rightly said, Jainani ma'am, and whether there is any marital discordance between them, and if she is complaining, maybe the entire experience is not a pleasurable one for her. That is why she wants
She's
she's come
complaining.
to us to
Yes.
take.
Yes.
So what is it? Why is she not having the same amount of outcome that the husband is having? Where is the issue for her? So maybe what they need is couple counseling, so that she can also get equal benefit of the act, not just the husband. So what they need maybe is couple counseling, along with, of course, treatment from us to address the issue.
yeah, I agree with Vaishali that this is something which our clients are not used to. They do not seek out counseling, and also trained counselors in this field also may be few. So marriage counselors are there, but not those who will actually address these sexual problems. So
Yes.
there is a very identified clinical entity. I think Jairani must be knowing
Yes.
about it, and that is FSD, female sexual dysfunction. So
Yes.
we must make some effort to diagnose FSD in our patient who
Yeah.
feels that participating in intercourse every day is a problem. And
So
I
first thing,
think
first
Maybe the other one
First
more
thing
thing
we have
also
to
that the husband
ask
must
them
be
first the question. Where many times we never ask them. They may come for leukorrhea, they may come for any
yes,
postmenopause,
leading
anything.
questions
But
are
we must
necessary.
ask them a leading question: how
leading
is their
questions.
sexual life?
Yes,
That we
yes.
never ask them. That is the first thing
Mm,
that we should do as a gynaec. So because in our
correct.
busy practice we forget to ask all these things. But
Mm-hmm.
every
We must ask a leading question and take proper
That would tell
history.
us
Yeah.
so that
what
we
it is.
have to look into it. They may have a cardiac problem, they may have a diabetes, but we never ask. We ask all about the other problems. We never ask about the sexual life. If we ask, that will be definitely leading us into a very different way, that it makes us more confident with her, and she can come out with a lot of issues that will help her to correct other problems also in the right way.
Yeah, in fact, Jayarani, you have disclosed my answer of the next question because you know that Sunita, the name is changed, of course.
Sir,
Sunita
your
was
voice is
accompanied by
breaking.
Anita. Both of them they had come together for this particular problem. Whereas I told you, Sunita was complaining of this, you know, daily intercourse. And then
So
after
I
our
think, sir,
discussion,
your internet
yes,
voice is breaking.
my voice is breaking. Now it's audible.
Yeah, yeah,
Yes,
yeah.
sir.
Audible? Okay, acha, good, good. So this was, you know, the Sunita was accompanied by Anita, and both of them were very good friends. So by the time actually I was doing the all those things, the examination about Sunita and all other things, Anita slowly opened up, and she said, "Doctor, exactly opposite problem with me. I am 45, but my husband has stopped keeping relations. Where I should go, what I should do." And then I told him, yes, your husband also needs in counseling as well as the examination. And to my surprise, it worked. He was diagnosed with the very high grade diabetes mellitus, which is a
Yeah.
common cause of decreased libido. And you know, then she said, "Oh my God, I never would have gone because he was asymptomatic." But this was a symptom again where she was not getting a pleasure of intercourse. So this story of Anita and Sunita always gave
Very,
me
very interestingly, we should look into the partner also, sir. The partner,
yes,
if he has an erectile dysfunction and she is so much unhappy about it, and
yes,
they start complaining to one another because the men also may develop a erectile dysfunction at this stage, so
yes,
they may
yes,
avoid sexual. I mean, that becomes a real trouble for both of them. So that also
yes,
one important aspect we have to look into the couple. As a couple, counseling is important, both
yes.
individual as well as couple. Yeah.
Correct.
Hmm.
And what happens, suppose we that is not properly dealt with, probably all those problems of promiscuity and all other problems, more chances of sexual infections and all that comes in the picture. So it is definitely a counseling of the couple which we need to insist upon whenever it is a something related to the aging and the sexuality as well. So about the other challenges of aging, anyone else want to add? I think Anand is still not joined. He's still in the meeting, but you all can take this particular question of other challenges. Yes, apart from the sexuality. Yes,
Challenges of falling sick, of having disease, of being dependent on somebody, yeah, inability to, perform day-to-day activities, and less energy levels. Whatever you were doing routinely, you are unable to do those, and losing independence basically because of the ill health. And as the person grows older,
Very important fear.
There's
deteriorating.
a lot of FOMO which is there. That feeling of left out also would be there. A lot of it that you're losing upon so many things. If you're getting old, that is also there. And you try to overdo it, and then the things are not getting corrected.
yes. So I think Anand has joined. Anand, are you
Yes,
there?
yes, I'm here.
Okay,
Can you
Anand,
feel me?
welcome. It's really a pleasure to meet you after a long time and that too virtually. See, we were discussing about all those problems of aging, the causes. We discussed about the sexuality problems, and we had wonderful stories actually by all panelists as well. And now we are dealing or have come up with the other problems which are associated with aging. Now, before we all speak, let me have your perspective about the aging process. Would it be female or could it be male? So what is your actually say on that?
aging? Something
Yes,
which is unavoidable
yes,
but can be retarded with some efforts,
yes,
right? How
correct,
you
yes.
do it depends. There are many ways. If you want to become somebody like Milind Soman, you know what to do. Very popular among mature ladies and very well preserved. Married to a person younger by 20 years and very happy. So he has simply stopped aging. He's looking the same as he was a model career about 20 years ago. So it is within our hands, but we all can't be Milind Soman. But let's do our stuff little more, consciously. Eat less, work more outside the house or outside your clinic. Have hobbies, have some free time, keep the mind fresh, prevent your Alzheimer by attending Amogs Sexual Committee and Indian Menopause Society Zoom meetings. It just prevents Alzheimer's, part of aging. There is no answer to it, Alzheimer,
Yeah,
unless you
very
remain
true.
active and engaged. Suddenly you find that you are in a memory loss clinic. So have students do thesis, research, publish papers. Milan, these are the ways. I'm not talking about probiotics and vitamins and testosterone supplements. I am not
Yes.
for it. Okay?
Yeah, very true. Very true, Anand. You are absolutely correct. There are n number of ways we can definitely revert actually this aging process as well. No, not necessarily physically, but mentally as well by doing all those things which are very well narrated by the Anand. Yes, but let me ask the other panelists as well. Can we slow down this aging and how? Yes.
Yeah, I think Milind, in the beginning itself, most of us responded that the key to retard aging is with a lifestyle change that makes a
Mhm.
new person out of us. I think
Yes.
we all agreed on that one has to change in every way, but in the way we think, in the way we plan, in the way we plan the day schedule. We need to become a different person in terms of very high focus on physical fitness, on diet, and also on fruitful interaction with colleagues, and on cutting down on stress generating activities like seeing too many patients or operating too much or taking on too much commitment, very too high profile work, taking on projects which we cannot. So reducing stress, in
Yes.
improving physical fitness, high focus on what we eat, and then managing our morbidities. Because
Yeah.
being Indians, aging is actually a higher challenge because we have very high NCD prevalence. We also have high cancer prevalence. And that is the reason we need to become a new person as we become older. That is what has been though I'm able to do it only in part. I feel that that is an important message we have to give to our patients.
Yes.
Unfortunately, the Indian aging woman is never free. She gets more and more involved into the family. You know,
Yes.
she becomes a grandmother.
Yeah.
All children dump all the
Dump
children on
on
her,
her.
and they go.
Yes.
So it's a paradox, but which she has to kind of live out of that paradox. Yeah.
Yes. Very true, Shobha, because this is a real story. People never speak about it, but they get these particular problems. Recently, one of my gynecologist friend was saying about it. He said, my daughter comes for the holiday, and sometimes then I get worried because there are so many demands they have actually from the parents, and they never understand the parents are also older now. About the involvement or other things were very told, but at the same time, the extremes of all that one need to tell them is not very good. For example,
Subha
exercise.
ma'am, yeah,
Yeah.
exercise. So I would also like to elaborate, especially strength
Yes.
training, weight lifting, all those strength training is very, very important because it builds the muscle, and muscle is the key, good muscle is the key to longevity. All these, in Europe, these Germans, these people from Switzerland, they are so much into adventure sports. They go hiking, trekking, adventure cycling at all age. So they have the quality of life is very good even at 80 and 85. They want good quality of life. So exercise with strength bearing or weight training is important. Same time diet, like we see the Japanese, they have this diet and they have really at 90 years also they're very active. It is a type of diet with more antioxidants, less sugar, like sir mentioned, and more fresh fruits, protein intake should be better. And we see even youngsters, people who have myocardial infarcts and cardiac events, that's all related to stress. So of course, yoga, meditation, mindful eating, mindfully doing things, is important, and good relationship. At the end of the day, your social interactions with your colleagues, with your friends is going to give you that emotional strength. So we like Madam said, we are Foxians, we are in Foxy. So we interact with a lot of people, and that really keeps us happy and young. So social interactions, close friend, family is very important, for healthy aging. So just
Correct.
One important thing
Yes.
is, as we do for the menopause, the sleep pattern is very
Sleep. Yeah.
important. Yeah,
Hmm.
because many a times the sleep deprivation, both by your menopause as by your aging, all these things have a very great impact. And youngsters, even this night shifts, day shifts changing, the sleep pattern changing has a lot of effect on the melatonin, and that has a very important effect on the obesity, cortisol level, everything that makes it very important for the sleep. So right from the adolescents to the aged people, we have to insist on sleeping, because nowadays with the social media, with the gadgets, with the technology, all people deprive the sleep, because every time it's like a day for them. They have light everywhere, they have all the gadgets, so their mind, their body, their eyes, their mind, everything gets activated all the time, and that makes their sleep deprived, which is definitely a very important factor which helps to regulate most of the systems of all our body, like our cortisol or all these factors play a very role in the obesity, your metabolic insults, everything happens because of that. So we have to be very correct and careful about the sleep pattern, which is very important, especially in the elderly. This is very important.
Yeah. So I want to ask Anand. I think Girija has not joined, isn't it? The panel, Madan. Hello, Madan.
Madan has gone for an emergency, I saw in the
Emergency.
chat
Acha.
box.
And I
Yeah.
think Girija was one of the panelists. I think she has not joined, isn't
So
it?
Girja is not joined.
Join. Okay. Then let me ask you all the next question, which is again very important, which I'm observing in my day-to-day work or day-to-day actually the discussion amongst the colleagues and the various members. Quite often, people to overcome this sleep disturbances, especially youngsters. For example, one of my actually pathologist friend was asking me, I'm finding little difficult. My children don't sleep till 3 a.m. And what about your family? What happens? And we realize, yes, it's very true that children, they are so much engaged with the social media and all other things, and they sleep very less. And quite few of them, they now want to use the melatonin for the sleep adjustment or making the sleep actually
Yes.
the disturbances. So what do you say on that? Have you experienced that people want to try or use the melatonin,
It is
Yes.
quite
Yes.
common.
positive and negative impacts? Yeah, I want to understand from
It
your,
is
yes.
very common in these adolescents to use that,
Yes,
because
yes, yes.
first is they are gadget freak. They would like to have all the gadgets on earth and then not to sleep. And they've got
Yes,
their priority time as if the day is not existent, and only in the night world they would be getting up and doing all the work,
yes,
whatever they have to do. And
yes,
they would be snoring away at 4 o'clock, 5 o'clock to glory, and then getting up in the morning by 12, 1 o'clock. And the reverse circadian rhythm will also cause lot of hormonal imbalances, lot of other eating disorders, and then obesity and all the NCDs coming into play because of that. So it has to be educated to them that our circadian rhythm is to sleep early in the night and do all the activities in the daytime, rather than indulging into your gadget activities and then spending your time with your idiot box. I would rather call it as an idiot box, and then
yes,
not doing your regular
Sir,
activities.
coming to your point of melatonin use for as a sedative, as a sleeping pill, this has been becoming a practice for many of the
Yes.
I know,
IT
yes,
people taking it.
yes,
But I saw one PCOS patient taking it very badly, getting into a psychiatric problem, because
correct,
that has a very great impact on the socializing. Because many times when they live their own world, they don't have, they will feel fresh, but at the same time, they feel little of their own. That's what I saw two patients. They were taking for the PCOS, they were taking the melatonin. Somebody has prescribed. So this is something in a younger age itself, they are getting this type of a long-term consequences because of melatonin. It is better to be avoided as a long-term process. All the more during the COVID, they say melatonin has a very good impact on preventing the COVID. Many started taking that melatonin, and that has a greatest impact on many of the middle-aged and the adult persons in their psychological concepts. That's what I saw in one paper regarding the melatonin. So long-term use has to be stopped, It can be given only for a little of the regularizing their sleep pattern, and it cannot be taken as a continuous medications. It may not produce an addiction, but it may produce some psychiatric, changes in their attitudes. That is what they say.
Yes. So that's very important. Whenever patients they come to us with these particular problems of aging as well as the sleep disturbances, we need to tell them the two important things. Yes, as all of you told about the eating properly and eating well, having good sleep with the help of all those lot of things available in the Indian scenario. Also, the yoga and meditation is a wonderful remedy to make this sleep pattern properly, and the exercises which should be adequate, not too much as well. And that's why when I listen about those gym deaths, which every often, every month you get one story on the WhatsApp, a particular person died in the gym, suddenly collapsed in the gym. I feel that the adequate word is equally important as well. So Anand, I want to ask you about the major health problems you find in this aging process and how they affect their overall life. So Anand, you want to say anything on that? Which are the major actually things which you find? Yes. I think again we lost Anand. It appears that he must have gone for again for the meeting. You're there, Anand? Okay. Anyone else can take then this
Yeah,
question
I
and
think the
yes.
major in old age group. So now we are no longer talking about women in the menopausal transition. We are talking about probably 65 plus. So, the geriatric age group, maybe it is now reclassified as more than 70 years. As I have already said, that many Indians have, the non-communicable diseases, as you have rightly listed out. And then it will be important to focus on how to importantly control each one of them. So the control, one needs to understand that most of these NCDs do not have cure, but they have control. And then what is in our hands is prevention of cancer, which is important. And then addressing mental illness very early, and prevention of osteoporosis by and large is possible, or at least delay the onset is possible. So the fragility fracture prevention is possible, because this can be started much earlier, and we all have gone through that education of menopause hormone therapy being highly successful in
Yes.
prevention of osteoporotic fractures. So maybe we need to inculcate those practices, and we need to tell women that earlier intervention with MHT is going to reduce all cause mortality. It has been seen that if women receive tailored MHT in time, like less than 60 years or within 10 years of menopause, it does reduce all cause mortality. So I would like to emphasize that. And also, mental illness is one thing which is and many times it is not diagnosed. It is not
Yes.
diagnosed. So that is something we need to focus on. Yeah,
Yeah.
mandatorily they should seek care for that, and we must ask leading questions. Yeah.
Very,
True.
very important. We should
Yeah.
screen them for the osteoporosis. What you said is very
Yes.
correct, Shobha,
Yes. Yes.
because many a times the cause for the death in an elderly woman is mostly the major, osteoporotic fractures. So ideally, we should screen them like the pap smear. They should screen for osteoporosis and give them a proper supplementation, and also an advice about the strength training and the exercise and their lifestyle and their safety in their lifestyle. All those
Yeah.
things has to be insisted in their elderly people, especially
Yes.
the
And ideally,
postmenopause.
Yes.
supplementation should be started at that very early stage, right from 35, 38 year, 40 years maximum. Any patient comes to the OPD, check for the D levels and the vitamin D and calcium levels and put them up on supplementation. That would definitely boost their energy also, their quality of life. Vitamin D is a wonder drug. It is not
Yes.
a vitamin, it is a wonder hormone, I would call it rather. And
Yeah, yeah, that's very wonderful that we should start it quite early. But sometimes, that we face that particular problem at little advanced age where there are n number of remedies which are very important of given even sometimes the parathormones. Because quite often nowadays we give that with the as per the suggestion by the orthopedic people, and that avoids those fractures of osteoporotic postmenopausal women. Only it need to be given for the longer duration and the cause factor, which is another thing. But quite often The patients are willing for it because the fracture makes them a lot of actually the agony and a lot of problems in their life. So we'll have to have the multi-speciality opinion for those particular women, and sometimes we'll have to think about giving those hormones also, which need to be given subcutaneously daily for at least 2 years with your all adjuvants, as all you said about. Now, before going for the further discussion, let me ask Madan and Anjali that yeah, yes, how much time we have, because otherwise we'll keep on continuing. Madan, you please tell me up to what time I can continue, or you give us a deadline.
Madan sir, hello, I'm Dr. Arundhati.
Anjali, yes, yes, you can, Arundhati, acha, you can tell
Yes.
me, yes.
Yeah, we have around till 6 o'clock our official timing. So another maybe 10 or 15 minutes more.
We can continue. Good, Arundhati,
Yes,
nice to
yes,
see you,
yes,
and
yes,
great, we'll
yes,
continue it, yeah.
yes,
So another 10 minutes and we'll wind up for sure.
yes.
And in between, any one of you want to give any important take-home messages? Probably I may be missing in discussion. Please tell me to address those particular issues. Otherwise, what I face actually very important in the aging process is the lot of myths actually people have. So what are the common myths about the aging process? Yes.
One important thing from the sexuality point of view is uh, with the menopause, many of the women in our Indian scenarios think that they should stop doing sex. That is one important myth. That is one thing that, and secondly, they always feel that after 60, you cannot do anything new. Very wrongly, they feel that your mind and body becomes very weak, so they cannot think, they cannot do anything new. This is also one thing very common. If you ask them to do this way of an exercise, they say, how come I can do, doctor? That is what you have to do, strength training. They don't believe it. How come I can do a strength training? So these are all something, a common myth. They believe that aging will make them defer this type of an exercise and their sexual life.
Yes, yeah. Anyone else want to add anything?
As I
Yeah,
had
I think
emphasized,
yeah, correct. One myth also is that they need to eat less, they need to fast more, है ना? And they kind of they need to be more careful about social interaction, that people will perceive otherwise. They may think that with age you must decrease your activities, something which like vanaprastha, that once you are old you can proceed for sannyasa, like that. So that is the common perception which older people had, but in
but
today's era that is not possible.
yes,
One has to understand that we have to live with the society in a more productive way, rather than less productive. And about eating, I think they have to eat more nutritious food, and they should not be eating less or more, but they have to eat more nutritious food. So there is a huge myth about diet out there, that is also, so they feel that all nutritious food should be taken by the younger people in the family, and they should eat very frugally and very less, because the digestive system weakens and they will not be able to manage. So those are the myths about diet and about social interaction. In general, about dressing up, they feel that they should use only sober colors, they should not be very vibrant in their expression. So these kind of myths will always prevail in Indian societies. To some extent there are family norms which one has to adhere to, but women who wish to express should not be kind of, like suppose someone wants to continue. I recently met a very senior classical singer who has retired. And when I asked her, Madam, why did you retire? You must continue to give stage performance. She is mother of a gynecologist. And she said, no, no, now it is enough. But I said, don't you sing anymore? She said, no, I sing the same. People who listen to me, they feel that I sing the same. But I feel, that at this age, now I'm close to 80, I should not, indulge in it. I should not do, maybe it is not good for my heart. I will stop giving performances. I have stopped giving performances for the past 5 years because I feel that I am, quite a senior, and let the younger people perform. So something like that. I don't think vocation or profession should be given up. If women are active in any profession, it should never be given up. I also had a very senior professor whom I consider as my guru in Bangalore, madam, and she stopped her OPD work, and of course operative work she stopped. That was very clear in her mind, but even OPDs she stopped. She said, what is there? I don't need to earn. My children are quite abundantly earning. So why should I go? And then immediately after 6 months, she started regretting. She started regretting because she felt that her old age would have been better if she had kept active involvement with patients in counseling. So that is how the myths will prevail, and later on there is chance for regret. So whenever possible, we must tell our women that post retirement also, and especially for housewives, if they have any potential, they can take up a new profession, they can take up new learning, new skills, and they can improvise there. So that is a very common myth. Even Jairani also brought out those myths. So I wanted to say this because I've observed this in my patients. Yeah, thank you.
So one
We
interesting
need to
thing I
be
want to say
lively at the
about,
heart.
I think
We need to be working till the last drop of our strength and never think that you will retire. Once you have that in your mind that you will retire, that means you're calling your aging, and whatever is your life, you are trying to get your age faster. And always work till the last drop of last strength of yours, and then you will never be aged. That is
So,
my understanding, and I would like to convey.
One talk I heard with Dr. Savita Rani, she's from Hyderabad. Madam is a very active senior gynecologist. One talk she was telling me, which was very interesting, is some young women came and asked, Google said this way. She said, see, I'm older than Google. So you cannot question me. I'm more knowledgeable than Google. So I'm very happy to say that I'm older, around more than 75, because I'm senior to Google. So I have all the knowledge more than Google. So it is something that you have to say, that when you're getting older, you're very happy about even your mind, body, knowledge, everything. That also one positive thing that we should tell our people when they're getting older. Don't feel bad about your aging. This is something that you should be inspired of, getting some more of your
Yes, very
experience
true.
and
In
expertise.
fact, these are the very
resign
important.
themselves. Women resign themselves, to their condition that they have aged. But, apart from work, they should pursue some kind of hobbies or some passion for which they maybe have not had time earlier because of small children or because of the work
Yes,
responsibility.
yes.
So at this point, maybe pursuing a hobby will definitely reduce the aging process and make the person more happier. So
Yeah, true. So yes,
I have
yes,
one
Anand. Yes,
additional
Anand.
remark.
Yes, Anand.
I asked my ladies, what do you miss when you are postmenopausal?
Sir?
What do you miss when you are postmenopausal? So many of them confide and say, we miss the male gaze. I said, what is a male gaze?
Sir,
said,
never, sir. What is there, sir? It is not. It is your mind, sir.
You know,
I said,
Milind, there is potential for war in this panel.
I know. I will have to take the voting now.
No. Anand, menopause itself means men. No, no pause.
No pause. Yeah.
Everything, every problem in the female starts with men.
No.
I'm
Yes.
talking about what they miss. They miss men turning their necks and seeing them repeatedly when they were 20 years younger. So how to counsel them? I found one idea. I said, now you watch the men. If men are not watching you, that is equally enjoyable. So they were happy. They were happy.
As
They
I
were
said, there
happy.
is potential for war in this panel, because I would tell them to dress in a way that, still one feels so confident that not only men, everybody looks at them. So it is, I have been insisting on that, one has to dress in a way which looks like a winner. It need not be very glamorous. It need not, but one has to dress in a way that, which, yes, very graceful, and which is, which
Elegant and
looks
respectful.
stunning,
Elegant and
very nice.
respectful.
It should be
Yeah.
very striking, and with the body language very erect and as fit as possible. So then one will not miss the male gaze because it will be there anyway.
Okay.
What
Great.
sir
Good.
is saying, probably because of this aspect, women go in for all these cosmetic surgeries, Botox and fillers, and so much
No, I'm sorting
apparently
it.
they miss it, and that is why they go towards that. And then
Yes.
we see so many, blotched up surgeries which are done, and the way they come out, and the typical collagen fillers, and
No, Vaishali, not all people think like that. See, it is not to keep their gaze. It is, as Madam said, we have to dress up in such a way that we are looked upon as an elegant and very strong
absolutely,
person.
I
That is
agree
what.
with you.
And they never go for all these things. Celebrities, maybe people who, celebrities may think like that, but not a routine, people who work on a
So,
corporate level or
no,
people
no,
who are working like,
ma'am,
they never go do that way. We
ma'am,
never.
things are changing. The area where I work, over there, at least every day I see patients, even young girls. And it is not only aging women, even young girls, people in their 30s undergo all kinds of things. And recently we did a panel on breast tumors and all. So I had to ask that question. Like, so many of these girls are coming with silicone implants, and it is rising, especially the place where I am
No.
practicing. A
No, that is
lot of
that
them
is
are
there
going
among the
for that.
young people. Now we are talking about the elderly, grazing
So
aged
elderly
people.
people going for Botox, they're going for collagen and some lifts and something they do for the eyebrows also. So all that is increasing now because they want to fight the cosmetic appearance. And they at least it shows them like they come down by 10 years, 5 years, 10 years. So yes, very much
They
there.
want, yeah, Vaishali, they want to look beautiful from outside, 20 years younger, suddenly, but the inside body, they are not working on it. The inside
Correct.
body,
If they do both,
osteoarthritis,
then it is worth it, Raki. If they do both, then it is worth
then
it.
it is
Yeah.
worth it. They do
Yeah.
only the external appearance and not work on the body function, the muscle mass, and the strengthening exercises. As soon as you stand up and you walk, what is the use of having a plastic
It's very
face
hollow.
and walk on a walker?
Becomes hollow.
Habits like smoking, alcohol, that damages the skin further. So they
Yeah.
go
Correct.
for cosmetic surgery at the same time they have these kind of habits also.
Yeah, correct. I just wanted to say, Vaishali, that, probably there are two kinds of aging women. Those who want to look younger, and maybe those who want to feel younger, and maybe maybe a bit of both is necessary. But then, given the choice, we must be those who actually are younger because they are having some kind of fitness mantra built into their daily lives, and which is both physical as well as nutritional and emotional and hormonal, everything. So the holistic care for the aging women, is the concept is very much there, and there is a place for cosmetic gynecology. Nobody is denying that, because see, Dr. Milind, very early on, he brought on a case where a woman did get relief. She did get relief with PRP therapy, and I also believe in that. But I feel that it is should be strictly guided by indication, and it should be conveyed that it is not going to last for life. It is going to, yeah. So Dr.
Repeated.
Milind brought it out very well, actually. So there is a
Thank you,
place
Shubha.
for, because I also get girls, who come and tell some complaint about the private parts. They will say this clitoris is bigger, or they will say the labia is too protruding, something like that.
Correct.
And I
Correct.
try to tell them something, because I don't practice cosmetic gynecology, but I do feel that they should not disfigure their genitalia by undergoing changes very early. So I do counsel them. Yeah.
Good,
Yeah.
good. So
I
wonderful
have
it was. Friends, there are n number of things actually in this aging gracefully, but yes, we should, always and always try to see that whatever we are doing, we should enjoy our actually the working in that particular thing, and that's what the most important it is. And that's why, Shobha, when I missed your dance in Isopa Vijayawada, I really felt that I should have been there for that day, actually, for the wonderful performance you gave. But anyways, maybe some other time.
Yeah. That is part of aging gracefully only.
Aging. Great. So thank you very much, friend. It was really a wonderful discussion, wonderful take-home messages, wonderful cases. I'm very sure all those actually delegates must have got benefited with all those things. And I must say big thanks once again to the entire group of the Amogs committee,
Yes.
especially Dr. Madan and Dr. Anjali and Arundhati and yeah, all others. Shubhda, I think she also left. So taking all those efforts, I missed meeting Kiran, Vipin and Anju Soni as well. But all of you stayed back till the last minute of this particular discussion, which was very important. And what actually we can pass on all this to our patients, to our friends, our colleagues, as well as our family members is always take the aging very gracefully. Don't get too worried about that. You can do major changes, suppose you do it very carefully. So thank you very much, all of you, Anand, Yaraki, Jayarani, Vaishali, and
Thank
Shobha
you.
for your deliberations. And I'm very sure this is quite useful to all of us. Thank you, the core team. That is again very important because they made this arrangement. Shubhankar, you're really wonderful, and it was really very nice to have all of you together. Thank you very much.
Thank you, sir. Thank you, one and
Thank
all.
you,
Thank you, sir.
Madan.
Thank you,
Thank you,
sir.
Madan.
Thank
I
you.
really enjoyed my
Yes.
time today.
Yes.
I really enjoyed.
Very much.
Enjoyed the
Bye,
panel
bye,
also.
Shubha.
Bye
Bye.
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 Bye,
Yeah.
Vaishali. Bye. Bye,
Bye.
Shubha.
Bye,
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 From
Jaya. Bye,
Amogs
Shubha.
everybody.
Bye.
Sexual Health Committee and IMS Pune, I thank all of you. Thank you so much.
Thank you,
It was
very
Thank you,
really
much.
good
Arundhati.
listening.
Thanks a
Yes.
lot.
Thank you.
Yeah.
Thank you.
Yes.
Thanks a
Thank
lot.
you.
Thank you.
Thank
Great to see
Yes.
you, सर सरांना खूप दिवसांनी पाहिलं.
you. मला आनंद भेटतो मधून मधून तेव्हा माझी गाठ पडते कुठं कुठं.
Yeah.
Good, good. Yes, yes.
Right.
Okay, see you then.
Well done. Well done.
Thank you, thank you, thank you.
Nice
Dost.
fun.
Yes, thank you.
Bye. Bye.
Bye.
Bye. Bye, Shobha ma'am. Bye.
Bye.
Bye
Bye.
bye.
Thank you, Karuna Group. Thanks a lot. Yeah, Shubhankar.
Yes, sir.
Yeah. I will come out with the dates and everything very soon. I was quite occupied
Yes,
with
sir.
so
I know.
many travels, but I will send it to you all
चालू
details.
से
You can
करने
start,
देना.
putting that way. Huh?
Yes, sir.
Thank you.
Sure, sir.
Thank you. Thanks a lot. Bye bye. Bye.
Bye, sir.